guys, welcome back to 3 Facts. So in addition to breast augmentation, another term you may have heard of is fat transfer. Now this isn't specific to breasts. In fact, it can be used quite well in the face and the butt as well, which is called the Brazilian butt lift. Now how I use it in my practice, I'm going to give you 3 facts about fat transfer. Number 1, fat transfer involves liposuction. Now a lot of people want to know how I get the fat. Essentially, it's a mini liposuction procedure. Usually obtained from the abdomen, sometimes the thighs if there's not enough fat in the abdomen. Like any lipo procedure, a fluid solution containing anesthetic as well as adrenaline is injected into the subcutaneous tissue or the fat that I'm harvesting. Then I use a long hollow cannula to suck out the amount of fat that's needed for the procedure. The incisions made for the liposuction, they're very small, they're only a few millimeters, and oftentimes I can get 1 incision for the abdomen, that's all you need. Number 2, not everyone needs a fat transfer. It's mainly the distribution of your existing breast tissue that determines whether or not a fat transfer is recommended. Now, if you have a wide gap between your breasts and you're wanting to achieve close cleavage, that's one reason to do it. Another one is that a lot of people have a very short distance between their nipple and their existing crease. Now the implant should expand that distance, but if you have a very tight fold, that's going to cause a complication called double bubble. Now the risk of double bubble can be reduced by adding fat to that area, and so that's why fat transfer to the bottom of the breast is a quite common procedure in my practice. Number 3, fat transfer is not an exact science, and by that I mean I can't calculate exactly how much fat will remain in any given breast. I usually expect about 70 to 80% of the fat that's injected to take or survive. The rest will then be absorbed by the body. So that means I have to inject a little bit more than I want. Now, it also means if I'm trying to use fat transfer as a way to correct asymmetry, it may require more than 1 procedure in order to fine-tune everything and get it exactly right, since the result at the time of surgery might not be exactly the same as the result, let's say 6 weeks down the track. I'm doing more and more fat transfer these days, and the benefits aren't limited to improvements in breast shape. The fat also contains stem cells and growth factors, which are very good for the skin. And so what I find is an improvement in the skin quality in the area where I inject the fat. So guys, if you could hit like and subscribe so you don't miss the upcoming video where I'll walk you through all the instruments used to perform a fat transfer, that would be great. I'll see you then.